Hello, I'm going to explain on the topic patient segmentation and disease risk prediction. With the data and simple machine learning algorithms, we can group patients based on their health parameters and even predict who is at higher risks for certain diseases. It's an emerging area that helping to improve outcomes and make healthcare more efficient. Introduction. Let's start by understanding what this topic really means. Patient segmentation is about dividing people into meaningful groups based on factors like age, BMI, and glucose levels. Disease risk prediction then uses those factors to estimate if a person is likely to develop a condition like diabetes. Combining these two give us a powerful way to personalize care and take action before problems get worse. We will go through real data set and two algorithms, K-means and K-means clustering and decision trees. Why segment and predict? Why is this important? Early detection saves lives by identifying high risk patients early. We can intervene sooner. It also helps hospitals and doctors focus resources better. Instead of treating everyone the same way, we can personalize care. This is not just good for patients, it also reduces costs, prevents hospital overload, and supports better public health decisions. Here we have a data set where it includes five patients and their health stacks like age, BMI, glucose, and risk level. Even though it's a small data set, it reflects common values found in real checkups. For example, patient 1 is young with healthy BMI and glucose, while patient 4 is older with higher values. We'll use this data to demonstrate how algorithms can identify patterns and make predictions. We have algorithm 1, which is K-means clustering. It groups similar patients into clusters. In our case, we used age and BMI to form two groups, where younger, healthier individuals and older, higher BMI individuals. These clusters help us identify which group might be more prone to health risks. For example, cluster 2 could represent a high risk group that doctors should monitor closely. Algorithm 2, decision tree. It is used to predict risk level. It's a simple rule based model that splits the data based on conditions. For example, if a patient BMI is over 30 and glucose is over 140, the tree classifies them as high risk. These clear if else rules make it easy for medical staff to understand and trust their predictions. Here we have a working example. Like, let's say a new patient comes in, like age that 50 and BMI that 31, glucose 145. We plug this data into our models. Uh, K-means would place them in the high risk cluster, as well as decision tree also classifies them as high risk because both BMI and glucose are above our threshold. This shows how even basic health info can be used to identify risk early and recommend preventive actions. We have a visual summary where on the left is the scatter plot from K-means, shows the patients are clustered. On the right, the decision tree shows the exact logic used to classify the patients. Together, they demonstrate how patients segmentation and prediction work hand in hand to support better healthcare decisions. I will show you the code for it. Mm, the first code, which is K-means, here. We start by importing pandas for data handling and matplotlib for plotting, and this is for KMeans. The dataset includes just two features, age and BMI for of five patients. These are common and impactful health matrices. We place them in the data frame using pandas. Next, we use K-means to divide the patients into two clusters. We fit the model using both age and BMI. The algorithm identifies patterns and assign a cluster number to each patient, either 0 or 1. which we add as a new column in the data frame. For visualization, we use a scatter plot that shows the clusters. Each point represents the patient plotted by age and BMI. We color code the clusters using red and blue, so it's easy to see how the patients are grouped. For example, one cluster might represent younger and healthier individuals, and the other could indicate older patients with higher BMI, potentially at greater risks. Finally, we label the axis and add a title and legend and display it to the chart. This helps us visually understand the segmentation and communicate finding early to healthcare providers and or decision makers. Next, we have a code for disease risk prediction with the decision tree. We start the data set, which includes BMI, glucose level, and risk label. The risk column is binary, which is 0 represents the low risk and 1 represents the high risk. We separate the features BMI and glucose and target label risk. Then we split the data using it into training and testing sets, using 80% of the data to train the model and 20% to test it. This helps us to evaluate how well the model generalizes to unseen data. After training, we predict the risk level for the test data. Then we generate a classification report which shows matrices like precision, recall, and accuracy. These help us to understand how well the model is performing. Finally, we visualize the decision tree. This makes the prediction process transparent. It shows the exact question the model asks, like is the if the glucose is greater than 135, and how does it makes decisions. This interpretability is especially valuable in healthcare applications where explainability is critical. Next, we have benefits. Benefits where patients get early warnings and personalized care. Hospitals avoid unnecessary costs and can focus on those who need help most. Doctors can design targeted interventions and it's scalable. You can apply it to communities, hospitals, or even at national level for better healthcare planning. Next, we have future scope. This approach can grow in many ways. We can use more features like blood pressure and cholesterol. Devices like smartwatches can give real time data with deep learning. We can handle more complex conditions, and we can move from predicting just one disease to predicting many, offering a complete health forecast. Conclusion, uh, patient segmentation and disease risk prediction are powerful tools that improve healthcare outcomes even with a small dataset and simple algorithms. We can identify who's at risk and offer early help. This approach makes healthcare smarter, more personal, and more effective. Thank you for listening.